I'm Dr. Deepak Kapoor. I'm president of Advanced Urology Centers of New York, the largest urology group practice in the United States. And I'm also president of the Large Urology Group Practice Association, representing about a third of private practice urologists in the United States. We're talking about choice. We're talking about providing patients with a piece of information that they can then use in consultation with their doctors, with their families, and choose what's right for them. You know, it really, when we talk about the USPSTF and this controversy, everybody that takes care of prostate cancer is, we're shaking our heads, regarding how this came to be. We just take a look at what we see, what we talked about earlier. Prior to the advent of increased awareness and early detection of prostate cancer, the 10-year survival for prostate cancer was 53%. It's now 99%. The overall survival rate from prostate cancer in the last 20 years has improved by 38%. The people who criticize broad-based screening are saying we're detecting all these cancers that don't need to be treated. The fact of the matter is that the incidence of prostate cancer has remained flat and has actually declined just a little bit. We're not detecting more cancers. We're detecting cancers earlier and saving lives. On that note, just earlier this month, there was a very important study that was published in the journal Cancer that showed that if PSA testing was not done, that 8,000 men a year more would lose their lives. Back in the past, a huge percentage of men presented with advanced disease. Now that number is extremely small. Whether you do active surveillance or radiation or surgery, the cost of managing prostate cancer prospectively is much less than the cost of managing a patient with advanced prostate cancer. The drugs that we use, the chemotherapy that we use, the support care that is necessary, the diagnostic tests that are needed to manage a patient with advanced disease are orders of magnitude greater than what it takes to treat a patient early. If we're not diagnosing these patients now, if we stop testing them, their disease is going to progress. And at some point in time, they're going to present with advanced disease. As I said, the study that I just quoted says that as many as 8,000 men a year would have develop advanced disease without PSA testing. What is the cost going to be to the system of treating these patients with far more expensive drugs and providing them with a lot more of expensive supportive care? Leave aside the human issue that these are men that shouldn't be dying that are dying. From a pure economic calculus, it makes sense to treat people early.